Hello, and welcome to our Summit Pacific Community Education. Tonight, we're going to have an honest discussion about suicide, and we've assembled a panel for you this evening. We're going to do a quick intro and then get the discussion going. So we have Jessica Madison with us tonight. Jessica, would you like to introduce yourself?
Sure. My name is Jessica Madison, and I am the school counselor down at HopeSquad.
Thank you. And then we have Chris Lushman, who I always mess up your last name. I'm really sorry, Chris.
That's okay. My name is Chris Lushman, and I work for Grayson County Public Health and Social Services.
Great, thank you. And we have Tiffany Renke.
So, hi, I'm Tiffany. I'm a medical assistant in the Wellness Center.
Great, thank you. And we are going to have one more guest come and join us in a little bit. She had a conflict which is going to make her a little bit late, but it's Stephanie Klinger, and she's the Director of Teaching and Learning over at the Montesano School District. So she'll be joining us in a little bit. And thank you again for joining us. So one of the reasons we decided to have this discussion is over the past, 6 months or so, we've been having lots of federal and state memos about mental health challenges that we might be seeing with this COVID pandemic. And having gone through all of the research, we decided that we really should just have a discussion because information about mental health and suicide in general usually lags about 2 years from when it happens to when the public gets the true numbers. But there was one survey that was done this past August, and it's the annual health and healthcare survey done by the Gallup poll, and they've been doing it since 2001. And in August, they did a survey of adults in the US, and they found that over 40% of adults were struggling with mental health issues and substance abuse. What was really disheartening was the younger age group of 18 to 24 was struggling the most, and they were at about a 75% rate of having mental health and substance abuse issues. So the CDC did a follow-up study, and they surveyed those same individuals, and when they asked them if they had had suicidal ideology or ideas about killing themselves within the past 30 days, 1 of every 4 of those individuals that they asked said yes. And that's really concerning. So we wanted to have a discussion about what's going on, but really what's going on in our community. And so that's why I asked some local experts, some people who work in the field, to join us tonight. And with that, I think I'm going to let you guys do the rest of the talking.
So I think I was, can you guys hear me? Okay, from the county point of view, again, I'm not an epidemiologist, so I don't interpret data. And what I'm going to say, the numbers might be off a little bit. But what we have seen that steadily since June, the number of positive cases has been increasing and increasing. The last report that I saw in December 31st of 2020, we had 2,354 new cases in Grays-Harbor County. And on January 11, 2021, we have increased by 2,622 new cases. So within 11 days, again, please don't take this like this is a gospel or something like that. Maybe I'm reading it wrong. So we have seen that in the 11 days, there has been 268 new cases. And for Grace Harbor County, we have about 27 confirmed death from that. And I believe, like you all know, like the incubation period for the illness is about 14, 15 days. And I'm just waiting to see during the New Year's, how is the number going? Is the number going to go up, or if the number is going to stay the same? But right now it appears like the number is going up. And that raises a lot of questions for me. If you guys remember if we can learn the lesson from the past, when the SARS pandemic started, people suffered a lot. And there was a lot of worry, there was a lot of anxiety, there was a lot of depression. And from that, even though SARS lasted only for a short period of time and we were able to contain it, I'm thinking about this COVID-19, the impact of it. And one of the things that, I don't know if you guys have heard about death of despair, because one of the hallmark of depression is loss of hope. And what I'm seeing is people has been having financial problem. There has been loss of employment, and this has caused a lot of homelessness. And there has been a lot of loss of the support system. And we know that if someone lost their employment and financial, there's a lot of things attached to it, your own identity and your progress that you're making, your contribution to your family and the community. And now you have lost everything and you have lost hope. And that's create despair. And when I was talking about death of despair, there were three things that was mentioned about death of despair. One is increasing overdose by drugs and suicide and alcohol poisoning, alcohol liver disease. And these are the three main things that death of despair, the loss of hope, brings in. And Grace Harbor County has suffered a lot. We are a poor county, and we were already suffering from homelessness and loss of employment. And with this COVID coming in, and now with a mandate of social distancing, isolation, and everything like that. So I strongly believe that I don't know, but I can see the waves coming. And I don't think we have enough resources to be able to help these people. And I'm glad that Cindy put this together, that we will be able to take care of this individual. So those that are already susceptible for mental health, their mental health will get worse. And those that are not susceptible, we are looking at some new trends might come in. There will be new worries, new anxiety, and new things might increase. And as you know, suicide is correlated very much with depression. And the loss of hope, that's the one that I am most concerned with. And especially the loss of emotional support and where are we getting support from friends and families and everything like that? and where we're going to turn to go to counseling or everything like that. And the worry for me is this. I just talked to a 21-year-old young man, great insurance. He had Blue Cross Blue Shield, called a counselor, wanted to go to counseling, feeling stressful. And his first payment through insurance was going to be $90 because he has to cover some other financial thing. So this is a 21-year-old male who has lost his job and everything like that. Now for about 6 sessions, he will have to pay $80 or $90, and then it will become $30 to $40. And who can afford $80 or $90 and employed? So this is the thing that we're going to see coming in, and I don't think, again, I don't want to be negative, but I don't feel like we are prepared for what is going to come for our children, our adult, and most especially our older adult, 65 and over. They don't have support. They live alone. And how are we going to reach out to them? Who's going to reach out to them? So I believe that we need to find a way to be able to connect people and instill hope and provide emotional support. But how do we do that? I do not know. Maybe something like this can help people and start moving, getting people to focus on that. Besides physical health, mental health, emotional health, everything like that is going to come into play to be able to stay healthy during this COVID-19. So I'm open to feedback. I'm open to other people's comments about that.
Hey, Chris. I really liked what you said about, how can we find ways to connect people more? Because that was something that at the end of every school year, our school district will put out a survey to families. There's one that goes to students, and then there's one that goes out to our community in Oakville. And one of the biggest things that we heard from all three groups was, how can we increase the social opportunities? And this was from the spring. So from the pandemic when it first happened in the spring. So that's been a lot of my effort this year, I think, is just how can I increase those social opportunities for the young people that I have the honor to work with. So it's definitely a big piece, I think, that's missing for a lot of people right now.
I know here at Summit Pacific, we've been using our screening tools to really help people open up and talk about how they're feeling and just really lay it out on the table. Those questions are hard to ask, but they're important. It's important to get everybody to start talking about it and not, just keeping it inside. That way we know what resources they need, or how often maybe they need to just be coming in and monitoring how they're feeling. I know that the numbers I was able to pull from the screening tools that we use, 2019, the beginning of the year was much higher for that depression screening, specifically March, April, and May. Whereas this year, 2020, it could reflect a little bit because of the social distancing and patients not coming into the clinic. But we saw a huge influx more in the summer, the June and July months, where people would be out, but they weren't. They were inside. And we saw a bigger increase in those depression screening, anxiety screenings. Patients were having more frequent feelings of depression or suicidal feelings because of being locked in during those summer months. So I know that we've really tried hard to bring the patients back into the clinic and make sure that they have, you know, whatever community resources we could, lots of different internet resources that they could go and look on their own and try to access that way, since we were indoors.
That's totally makes sense, because during summer, you know, when we look forward to summer, and because staying outside make us feel good, we are with family, we are with friends, we are walking more and everything like that, and that being diminished, that would create anxiety, worry, and probably depression.
Yeah. And those numbers have just they've come down a bit since the month of July, but they're still more elevated through the remainder of the year. I'm curious to see what our numbers will look like for those screening tools coming into, you know, these winter months and coming out of the winter months into the new year, given our area.
So I just wanted to pop in and say hello. I'm Stephanie Klinger. I'm our Director of Teaching and Learning from the Montesano School District. And Cindy was so kind to let me pop in a little bit late. We've had a lot of competing Zoom meetings, as you can imagine, while we're gearing up for hybrid learning. Our school just started K-6 on Monday, so we have a lot going on in our school district. But I'm really excited to be part of this conversation and listen to the perspectives, particularly in the health field. And it's great to hear what's happening in Oakville School District to make some connections there as well. Was really struck by the sense of connection, and that's one of the things that we've been really emphasizing in our school district as well. Is making sure that our staff and students are feeling connected and our families are feeling connected, and that's what we are really seeing in our school district is one of the biggest problems. And then where to go when they are identifying a problem or ready to reach out for help. Self-care seems to be people are really managing self-care really well, but they're really struggling on where do I go when I need to reach out. So that's one of the resources that we'd really love to have, something really handy and readily available, so we know just exactly where to direct people.
So some of the internet sites. Hi, Cindy. I was just going to mention a couple. One internet website that we've used here in Summit and found really beneficial. There's lots of education for not only those who are having and struggling with those thoughts of suicide or depression, but also the family members, how they can help and recognize those symptoms and kind of be that support for them. Is the nowmattersnow.org. That's been a really resourceful tool that we've used here in Summit Pacific.
I was looking at it, and I think that since we are isolated and there's a lot of loneliness and you can't access the counselor's office, and I think Now Matter Now, that was my first choice of you can go there, you can be alone, and there's several, you can learn about stress management, and then there's also online therapy, cognitive behavior therapy offered by Ursula. And so I would recommend anyone during this time and everything like that to go to the website and visit it, take a class, and come back to it and everything like that. If we cannot access, our primary care doctor or a counselor, that they themselves, they are overwhelmed and they don't. So I think there was a recent study, I don't know what country, that they said that really having therapy online, cognitive behavior therapy online, has been helping them. So that's why I went to Now Matter Now, and I saw that there is online therapy for a few sessions. And being in private, you can share your thoughts and everything like that. So I think that's very safe, and that might reduce the risk of suicide and depression.
Mm-hmm. Yeah.
But having said that, I am working with some special population here, that some of them don't have phone and some don't have access to to a computer, and they used to go to the library to access everything, and now all the library here is closed and everything like that. So that has been causing them to be more isolated, feel more like more worries, what I'm lacking, how would I be able to do that? And that is creating more despair. And I have seen an increase in drug use. I'm seeing a lot of increase in wounds from people who inject drugs. And at the back of my mind, I'm always thinking about, it's going to get worse because these people are homeless, don't have any resources, and they have started to increase their drug use. And anything can tilt them, like what the use of living. So I'm watching for this population a little bit and trying to offer something. So that was my little piece.
Yeah, being out in the working with Oakville and some of the rural community out there, it's something that's been on my mind too when working with students. Is I think the more isolated that we've been, I think it lends a hand to increase all those other risk factors for suicide. So I'm always trying to keep an eye out for it and trying to ask that question and have those conversations with students, just because everything is so hard right now. And yeah.
I know that here at Summit, when a patient's coming in and that they've answered positively to the screening tools that we've had, and we take it one step further and ask, do you have a plan? Do you have ways that you would follow through with this? And really try to open them up, and then we have a safety plan, try to help them identify what those triggers are, or those things that are really causing them to feel that depression or that anxiety that's bringing them to that point of suicidal thoughts. And then bringing them back, giving a phone call, in 48 hours, trying to reach back out as a provider, getting them back into the office in, a week, in 2 weeks. And as they exit, giving them that safety plan that we had worked through, make sure that they have the crisis line in their phone or some way to call. There is always that handicap when they don't have the means of internet or Wi-Fi, or they don't have a phone. which makes it hard. It requires them to come into the office for those visits. And, the hope always is that they'll be able to come and make it to those appointments.
Are you using the PHQ-9 or what type of thing?
Yeah. So PHQ-9 for the depression screening, and then GAD-7, which is more geared towards anxiety, but the same type of scoring.
Let me share something about, I've learned that by experience, and I have been very sad for learning it by experience. Very often when we are asking someone, do you have a plan? And they will tell you about a little plan. I've learned that not to stop there.
Right.
Because very often when people are suicidal, they might have one or two plans. And you ask them, okay, what's your plan? And say, oh, I was thinking about OD. I've been collecting all my medication. And we start making a plan and we think that's okay. But at the same time, they might have a gun or a rope somewhere. That's their go-to. So you guys are professional. I'm not trying to tell you guys how to, but
no, that's a great.
No, I have learned during the crisis thing. We lost some people, and just ask, what's your plan? And then they give you another plan, and make sure we ask them, what else have you been thinking about? Do you have any other thing that you have been contemplating or something like that? You will be surprised of some people, like they will have 2 plan or 3 plan or everything like that. And I have been caught off guard by just asking the first thing, and as soon as they mention their plan, then I think that's it, and I do something with their plan, and later on I find out that the person committed suicide by another means. So that was just a little bit, because you working in the hospital and Jessica working in school, if someone share a plan, let's try to see if they have another plan or another thing they have been contemplating. So.
Yeah.
Yeah, definitely. And I think too, for anybody, I think just if you notice that something is off with somebody that you know, or if you notice something, like, just ask. I know it's a really uncomfortable question to ask somebody if they might be feeling like they're suicidal or if they're having thoughts about killing themselves. But I think because that question can be so hard to ask, that you might be the first person that asks that question for that person. And that might be the first time that they have a space to be able to talk about it. Because most people, I think, when they are having those thoughts, they're giving off some sort of warning signs or warning signals. And a lot of times those can be direct or they can be really indirect. So I think it's, it might be things that they're saying, it might be things that they're doing. They might start giving away their things. They might just start withdrawing from everybody that they know. Maybe their sleep is like way too much or way too less, or just acting out of norm. So just keeping an eye out for those things. And especially right now, I think checking in with those people is big, keeping an eye on one another.
I think you're right. We don't need to talk too much. We just need to see them where they are and just be there for them, like this social support, like a support there. And We don't have to use therapy language or something like that. Basic language, no. So I like what you say, that we need to watch out, or if people has step out of their normal behavior.
And I think something that I've told people before, in like kind of preparing them to have those conversations with people is, you know, I think what people most want in those moments when they are feeling suicidal is they just want to feel connected to somebody. That might be the first real conversation that they've had about themselves or their thoughts or their feelings in a really long time. And so putting away the fear of, I need to ask this person this really horrifying question and I'm not sure what I'm going to do when they give me their answer. But just using that as a moment to listen to them and hear them out and to connect with them, for sure.
Yeah.
I think you're right. I think that if someone is feeling safe and someone is feeling connected and they're feeling a little bit of self-control, like they have some type of control in their life, I don't think someone will go ahead and kill themselves. It's just like when they don't feel safe, they're feeling like their life is out of control, hopelessness, and they have no one to turn to. And I think that might tilt them to do that. So I like what you said. So the big question is, how do we make people feel safe, and then connected? How do we offer them safety and bring some calmness in their life in the midst of their suffering? So I guess this is why we're having this conversation, right?
And I think that starts with, you know, a free space or a safe space where they can talk, just asking those questions and then just listening. Like we've said, multiple times, they're not easy questions to ask, but once they're out on the table, and you'd be surprised how much people open up. And just, if you're just there to listen, people just need to be heard a lot of times. They don't need an answer. They need to be heard.
And sometimes with providers, if someone is really depressed or anxious, they get so narrow focused, they can see only little thing. And as a provider, when you're meeting with them, you know what I mean? Your scope is so big. And then when you start talking to them, there's something that they might have missed, or they might give them some hope. Oh, I never thought about this. Maybe it's worth trying it, and everything like that. Like you say, you know what I mean? If someone is hurting, you said, let's go visit Now Matter Now and look at these things. He might just click and say, yeah, I like that. So postpone what my thing is and see how this work out.
Mm-hmm.
So you're right.
A couple of other resources that I've used a lot in my work is if I have this conversation with a kiddo, they leave with a couple of resources from me. They normally leave with the Grays Harbor Crisis Line, which is 24-hour phone number that they can call and talk to somebody about anything. And they can be anonymous if they want to. If students are a little nervous to make that phone call, sometimes I'll make a call with them while they're in the office with me, just so they can see how that process works. And the line operators are always like just fabulous about it. And then I'll refer to the crisis text line a lot, because I think kids sometimes, it's easier to have that texting conversation in a moment when those thoughts start to pop into your head. And so I think that's a resource that I've definitely used a lot.
You know, I've even found in my own home that's a really great point about the texting. My kids, you know, even in my own home, if I can sense that they're just a little off, or, you know, something just doesn't seem right about them, they've been distant, you'd be surprised just sending a text to them. You're in the same house. I know it seems ironic, but there is a sense of comfort there for them to just be able to text their thoughts out and not actually have to be face to face and verbalize everything. But it gives them that time to process. It gives them time to put their words together with the, you know, without the atmosphere of anxiety of, you know, the face to face situation. Friends, family, you know, that could be anybody, not just children. You know, that source of texting, I think, is a really good avenue to take to just kind of inquire and see if someone will open up a little bit.
Something else that we've, it's pretty new for us down at the school, but last year was our first year with the HopeSquad program. And that was help funded for the community suicide prevention grant. Last year was our first year with it, and the kids got so excited about it. And I think the number one thing that I had heard from them is that they felt like the conversations that we were having were important, and they felt like it was stuff that they didn't normally get the chance to talk about. They didn't get the chance to talk about mental health or suicide, and they just felt that having this as an avenue for them to help have those conversations with their peers and to help their peers get help as well, I think it's been really, it's just been really awesome to do that work with them. And this is our second year, and we just got some new squad members on board. So I'm excited with all the cool things that we're going to be able to do before the year ends.
Jessica, thank you for speaking about HopeSquad. That was something that Chris and I actually were able to help you get started. And I know the Montesano schools have the HopeSquad this year. Unfortunately, Stephanie wasn't able to stay and tell us what they were able to do, trying to start it in the COVID situation. So maybe they're going to be a year behind you. Do you want to talk for just 2 more minutes about how the HopeSquad works in the schools? Because it's in the elementary as well as through the upper grades.
Yeah, so I'm glad you brought that up. So we were fortunate enough with your and Chris's help with that to get a grant for the HopeSquad program for our elementary school, our middle school, and our high school. So the elementary team is made up of 4th and 5th graders that were nominated by their peers as being a good friend, someone who is helpful to talk to, someone who cares about others, just like really cool things. And we put together those teams, and then those kids get trained a little bit in what's we call QPR. So it stands for question, persuade, and refer. And that just gives the students the tools to keep a lookout for warning signs of suicide. And if they see somebody that might be struggling, now that they have the tools to be able to walk over and have that conversation and ask that question and say, hey, are you thinking about suicide, or have you had these thoughts? And then they're able to help that student or that friend come to me, where then I'll get the kids connected with the resources that they need and make all of those phone calls for them and support them in that. So the kids end up really being like my eyes and ears of the things going on with the student population, because I think especially with kids, they don't always want to tell me all the time, but they might tell their friends, or they might tell somebody else, or their friends might see something that I don't see. So the Hope Squad kids have been super awesome in that, and they've been helpful with their referrals. The fun side of Hope Squad is that we get to do a lot with, like, we talk about bullying, we talk about mental health, we get to do fun, positive things around the school to try to just boost morale and all those cool things. So it's been really fun, and I love the program.
That's awesome. And just to fill out, in the county, besides Oakville and Montesano, Chris, what other schools are part of the Hope Squad network?
I think Hoquiam School was part of the Hope Squad, and then we were trying to start with Aberdeen School, but with COVID came in and all these things, so I don't know if they took a pause or not. But I think I like what Jessica is saying, and I'm always thinking about that. We have too much stigma around mental health and suicide. Like, if you say you have mental health, that's mean that you're crazy. You know what I mean? You ain't good enough. You know what I mean? You're never going to succeed in your life. You're going to be a loser, or you're going to end up walking barefoot, ragged clothes on the street. And that's why very often people are very hesitant or scared about talking about, I'm feeling depressed, or I am. These are the things that is going on. But I'm glad with Hope Squad, they will talk about it like any other topic or like any other illness. Like there's no shame in it. And I think this is a greatest thing that can happen, that we stop seeing mental health as another type of problem to be ashamed of, and something like that.
Yeah, that's a great point. Thank you for bringing that up. I would just wanted to ask, was Grays Harbor College going to do the Hope Squad too? Was that something that finally came to fruition?
We trained advisors and everything like that. Then with, again, budget cut, new advisors, and new student support, new student thing came in, and then this whole COVID-19 happened, and then so
it didn't get off the ground yet.
No, it didn't get off the ground.
Yeah. For those of you who are wondering, Hope Squad is actually an international program started in Utah. It's in about 18 states in the US, Canada, Spain, and I think 1 or 2 other countries. But Grays Harbor County has 4 school districts, 1 potential college, and in Washington State, yeah, you should be doing that, Jessica. It's awesome. There's only 1 other Hope Squad in the rest of our state. So Grays Harbor County is like Hope County, Washington. It's awesome. So we're really proud of that. And this is a shameless plug, but Chris and I had the opportunity to go out to Utah to train with the Hope Squad and to bring it back to the county. And so I don't know about you, Chris, but I still want to see more school districts become Hope Squads. So hopefully this will be a little zing in somebody's ear to talk to your school districts about getting a Hope Squad, because pandemic or not, we need this. We need this all the time. And Grays Harbor County in our state, Chris, correct me, are we the 4th highest rate in our state, or have we come down?
I don't know. You know, the Healthy Youth Survey comes every 2 years. So, so I don't know when is the next one.
Yeah, but we have 39 counties, and I think we were ranked 37th. So we were pretty high up there. I know that sounds backwards, but that's how the state ranked us. But yeah, and I don't mean to take over the conversation, but there is one more thing that people on your Facebook page, we did put, or will put, a list of the resources that Tiffany and Jessica and Chris have been talking about. So you do have those resources, and it's just the small list. There are so many resources out there, but we tried to cull the ones that would be the most useful. Yeah. So last thoughts, my friends. Tiffany, would you like any last thoughts?
I think it's great that we're doing this, coming together, different spots in the community, and just start talking. That's where it starts, right? Does everybody start talking, start getting a movement going? I'd love to see my kids go to North Beach. I'd love to see Hope Squad out there in North Beach. I know they could definitely use it. So yeah, I'm just glad we were able to come together.
Great. We'll put a bug in the superintendent's ear, Tiff.
That's right.
Yeah. And Jessica, last thoughts for you?
Yeah, to echo a little bit of what Tiffany just said, I feel really honored to be a part of this discussion. I think it's a super important topic that is definitely much needed, especially now. And I think, you know, the more that we talk about it, the more that we'll be comfortable talking about it when there is something that we need to ask somebody, or if somebody needs help, they can get it.
Wonderful. And Chris, my friend, last thoughts from you, sir?
I think that we need to continue to have this type of conversation. I'm so grateful that Summit Pacific is doing this, because we need to get a feel of what's going on in the county, you know, the gap of where things are happening and where it's not happening. And without this conversation, we won't know. And then when the waves hit, we won't be prepared. But like this, having resources and everything like that, I think we can prepare people a little bit more and give them a little bit more hope that there are people that are interested. You know what I mean? Summit Pacific is interested in their well-being, whole well-being. You know what I mean? Physical, mental, emotional, social well-being. And people from Oakville will know that, oh, we have Jessica that is really invested and interested in helping us. And I think these type of things bring hope to people and give them strength and give them courage, like at least someone care for us. So I think we do need to have this type of conversation often, and bring new ideas and bring what we are hearing in the community and how we can help out. So that's what my hope is, that we can meet again and try to see what we can add to this forum. Or yeah.
Okay, well, maybe we'll have to get together this time next year and check in again. hopefully we'll be able to sit in the same room and have the discussion. And I just want to do a special shout out to the Grays Harbor County Public Health and Social Services. You guys have the longest name I've ever had to repeat. But, and thank you to Beth Mitsushima, who was the actual person who reached out originally and started this whole zero suicide initiative with us at Summit Pacific. And she's got the HopeSquad connection. She's one of the deputy directors over at the county. And just want a big thank you to Beth, because I think without her leading Chris's department, we wouldn't have seen all this wonderful work in the county. So I just wanted to include her in this. And thank you everyone for all the wonderful work that you do for everyone in Grays Harbor County. And it really does trickle to everyone else in the state, making our kids safe, making everyone healthy. And I just hope you all continue to do the wonderful work that you are doing right now. And I thank you for being part of this wonderful and much needed discussion. So thank you again.
Oh, thank you for putting that together.
Yeah, thank you for bringing us together.
Yes.
My pleasure. And with that, thank you all for tuning in, and I hope you got something out of it. If you have any questions, and if they're specific for anyone, we will make sure that they get it, and we'll get the answers out, posted here on Facebook, or if you want it to you personally, give us a contact and we'll get you your answers. And again, thank you everyone for being part of the panel, and we're going to sign off.
All right. Thank you. Bye-bye, you guys.
Bye.
Bye-bye.